Bacterial Pathogenesis and Major Bacterial Pathogens, presented by Taylor Garner. Bacterial pathogenesis is defined as the process in which bacteria cause disease in a host organism. Simply stated, this happens when bacteria successfully enter our body and cause disease as a result. Just to clarify, the word pathogenesis refers to the manner of development of disease, and a pathogen is any organism that can cause disease in a host organism. And any living thing is a potential host organism. Throughout this presentation, I will discuss how infectious diseases are acquired by humans, the stages of bacterial pathogenesis, and major mechanisms of disease causation. I will also dive into major bacterial pathogens and how studying them helps. First, I wanted to talk about bacteria. So in order to further understand bacterial pathogenesis, we must first define bacteria. Bacteria are microscopic organisms that are present everywhere in our lives. They can be thought of as harmful, but that is not always the case. We have many types of good bacteria, some of which help us with digestion and even help us to fight off harmful pathogens. However, harmful bacteria can cause a wide range of infections in living organisms. When talking about these infections caused by bacteria, they persist when germs enter the body and the immune system cannot stop them. Pathogens can overpower the immune response depending on two factors: the number of organisms present in the body and the virulence of these pathogenic organisms. When there's a significant amount of harmful bacteria present, there's a greater likelihood of infection. Virulence also plays a role in bacteria overpowering the immune system. Virulence is the degree to which a pathogen can cause disease. If a pathogen has high virulence, it causes severe disease, while low virulence is indicative of milder disease. Though our immune system's sole purpose is to protect our bodies from infection, there are several factors that hinder this process. If our immune systems are compromised in any way, pathogens are more likely to invade the body successfully. Examples of our immune system being compromised are people having autoimmune disorders like lupus or cancer. The body can also be compromised if it is already going through treatment for another medical condition. An example of this would be chemotherapy or radiation. Now that we have discussed bacteria and infection in humans, we will take a look at the steps that it takes for bacteria to cause disease in the host or the body. The first step is transmission from an external source into the portal of entry. The port of entry is the first point at which the bacteria can enter the body. The next step in pathogenesis is the evasion of primary host defenses of the body. An example of primary host defenses are the skin and mucous membranes, which contain ways to keep bacteria out of the body. The next step is adherence or colonization of bacteria to the mucous membranes. The bacteria have to successfully attach to the mucous membranes. And following adherence, the bacteria replicate at the site of attachment. Once they replicate, disease symptoms start to become visible. These symptoms are caused by either toxin production or invasion and are accompanied by inflammation. Host responses, which are innate and adaptive immunity, happen starting at step 3 through 5. From here, there can either be progression or resolution of the disease. The major mechanisms by which bacterial pathogenesis occurs are toxin production and invasion, followed by inflammation. During invasion, bacteria attach to and enter body tissues, allowing them to hide from the immune system and spread throughout the body. Inflammation occurs when the body's immune system reacts to the infection, causing redness, swelling, and pain. Although inflammation helps fight off bacteria, it can lead to tissue damage and illness symptoms. The other mechanism by which bacteria can cause disease is toxin production. And it occurs when bacteria release toxins that damage host cells and tissues. These toxins can disrupt normal functions, destroy cells, or interfere with the body's immune response. As a result, the toxins cause many of the symptoms seen in bacterial infections, such as fever, diarrhea, or tissue damage. Major bacterial pathogens. These are bacteria that commonly cause disease in humans, such as Staphylococcus aureus and Mycobacterium tuberculosis. These bacteria can lead to a wide range of illnesses, from mild infections to serious diseases that affect major organs. These bacteria are widely studied, and this is important because it helps scientists and healthcare workers understand how they cause disease, how they spread, and how to prevent or treat infections. This knowledge is essential for developing antibiotics, vaccines, and other strategies to protect public health. Major bacterial pathogens are often categorized based on how they react to a gram stain and by their shape. A gram stain is a special laboratory test used to tell different types of bacteria apart. During gram staining, bacteria are stained with a purple dye and then treated with other chemicals. Gram-positive bacteria are able to keep the purple stain and can appear pink or red due to thinner cell walls. This difference is while gram-negative bacteria is the ones that lose the purple stain and are like pink in color. The difference between these are important because it helps determine how bacteria respond to antibiotics. In addition to staining, bacteria are also classified by their shape, such as cocci, bacilli, or spirilla. Understanding these features helps scientists and healthcare workers identify bacteria accurately and choose the best treatment for infections. I also wanted to mention how some bacteria are capable of causing more than one type of a disease depending on where they infect the body, person's immune response, or the conditions of infection. For example, Streptococcus pyogenes can cause mild illness like strep throat, but can also lead to more serious diseases such as scarlet fever or skin infections. This is able to happen because the same bacterium can produce different toxins or use various mechanisms to infect different tissues. Understanding this helps healthcare providers recognize how one type of bacteria can lead to a range of symptoms and illnesses. In conclusion, understanding bacterial pathogenesis and major bacterial pathogens is essential for recognizing how diseases develop and how they can be prevented or treated. Bacteria use several mechanisms such as invasion, toxin production, and inflammation to cause illness in humans. By studying these processes as well as the ways bacteria are classified and identified, scientists and healthcare professionals can better detect infections and create effective treatments. Since some bacteria can cause multiple types of diseases, ongoing research is important for improving public health, developing new antibiotics and vaccines, and ultimately saving lives. And these are a list of references that I used to complete this presentation.